Okay. So obviously, this is the second of our, is it the second or third of our maternity assemblies? Third, I think. Yes, third. I'm just going to introduce the day. I'm not clicking. Oh, I am clicking. I've explained who I am. I've said welcome. Okay, so I'm just going to do a little bit of an introduction and a bit of a journey so far before we kick off the day. So some basic housekeeping, necessary housekeeping. I think most people have been told as they've come in, there are no planned fire alarms today. So should an alarm go off, then we all need to exit by the nearest available exit and congregate in the car park. You will notice various cameras around the place. So the event today is being filmed, so it will be available for people to access after the event. If people have any problem with things being filmed and photographed, we will be taking photos around to tweet or put on Facebook and things of the event. So if anybody's got any problem with being photographed, if you want to make yourself known to Anna, who will be doing a lot of the photographing, and I've lost her, Louise at the back, then we'll make sure that you're taken off the photos if that's what you wish. Mobile phones, as usual, you might be on call or whatever, that's fine, but can you please put them on vibrate? Programme, I've talked about Slido. The programme today, unlike the programme at the last assembly, there is quite a lot until we get to this afternoon of sitting and listening to people. So use the Slido in terms of a way to interact during those, because I'm a bit conscious that we're not moving around as we have done before as much until we get to the workshops this afternoon. There's evaluation forms in your bag, along with the programme, some biographies of the people that are speaking to you today, and also biographies of the Better Births team, so you can identify people in the room. And there's also a couple of sweets in there for you to keep your energy levels up as you go through the day. Because we're arranged as we are today, it was a bit difficult to put bowls of sweets out for you, so they've just been put in the bags. And finally, just on the housekeeping, is just please engage with us, please ask the questions, please fill in the evaluation forms, and enjoy yourselves and have a good day. I don't know whether this statement makes you feel like the lady on the left or the family on the right, but we are more than halfway through the maternity 5-year forward time frame. So Better Births is there to be delivered by March 2021. It was a 5-year programme, so we are more than halfway through that now. So on some days, I must admit, it makes me feel like the lady on the left. And on many days, it makes me feel like the family on the right. But I think we've all got different feelings on different days as to how much of a hill we think we've got to climb to actually deliver all those recommendations. So just a bit, these slides look very nice. Can who's ever tweet these for me? They look very good. So things that have happened so far, probably since we last came together in June, and many of these things are the themes that we're going to be pulling out during the day, that you'll hear from the speakers. So we've got work streams established across the whole programme. We've got a marketing and communications plan in place, Dave, yes? In place. You'll notice on the bags and on the other materials that we have adopted the strapline that people designed at the last assembly. So what matters to you matters to us. We came up with at the last assembly meeting at the Gujarati Centre, and that's now been adopted by the team. We have an active Facebook and Twitter account, planning some road shows around the patch, both to engage with staff and service users and public and mums and dads and everybody. And we're definitely getting out and about with Anna, who's our family engagement coordinator, doing work with the Maternity Voices partnerships and also with a whole range of other groups and community groups that are out to understand their stories and in what ways we can make maternity services better for people. All providers completed their digital maturity assessments, and Ben is speaking later from NHS Digital, who will bring out some of the themes from that for us in terms of where we are as a digital maternity community. We are hopefully appointing a digital champion to the team next week, is interviews for that. Very keen to look at how we can increase the use of technology in terms of maternity care. So again, there's a workshop this afternoon if people want to engage in that around how we can think digital a bit better. We've set up and established an infant feeding project, and again, Katie will be speaking to us later today, this morning, and running a workshop this afternoon around that. We have an ambition for the LMS to be one of the first LMSs in the country for all providers to be UNICEF BFI accredited. We've got some fantastic examples in the patch, with East Lancs being the first in the world to have got gold accreditation for UNICEF BFI. So we now need to support the other providers to get on board, and for most of them, finish or restart a journey that they've been on before, but everybody's at slightly different stages. So we want to support that as a key deliverable, and I'm sure Charlie might mention around infant feeding when we're talking about postnatal later this morning. Workforce scoping, we've had the support of Kendall Block that you heard from at the last assembly, doing the workforce scoping. We're now moving on to the possibility of phase 2 around that, to actually do some service modelling in terms of what that looks like for the future. As you'll all appreciate, it's not possible to look at maternity in isolation. So that's being looked at in the context of the whole women and children's services, because obviously where paediatrics is has a knock-on effect to where neonatology can be, which has a knock-on effect to where maternity can be, etc., etc., etc. So we are quite literally going to have a process probably of sitting around a table with some Lego to fit things together as to what absolutely can't be split apart and what needs to stay in one place. Options about new roles. Catherine's going to be speaking after me from Health Education England around some of the stuff around the maternity strategy that's come out nationally from HEE, and what that might mean for us locally and how we could start exploring new roles. I think those that were there at the last assembly, we heard about the great examples in Blackpool for their maternity health trainer, that sort of thing, adopting novel and innovative ways of working. Come on in, don't be shy. Sorry. Honestly, just can't trust the managers, can you? Linking with HEIs, so we're making some positive links certainly with UCLAN around maternity midwifery training to make sure that the messages through Better Births and things are those that are linked in with training, and really wanting some of that voice of the midwifery student particularly into what we're doing. They are the workforce of the future. So they're linking in with us now. And for anybody that's interested, the prevention coordinator for the Best Births team is currently out to advert. So please, anybody interested, put your hat in the ring. And that will be a fantastic role again, working across with public health and the Better Births team and looking at the whole prevention agenda around maternity.